Mrs. Miggins, like to go down to surgery 4?
Hello, Millie. Are you feeling okay?
Yeah? Why?
Well, couldn't help noticing the scarf. Wondered if you've got a cold or something.
No, I'm fine. Dr. Fideo says he's going to turn the heating down to save on the energy bill.
But it's not cold enough to have the heating on yet.
Yeah, I know.
So why? Oh, never mind. Is he in yet?
Yep, but I just sent Mrs. Miggins down to his surgery.
Okay. Well, I've got some treatment plans to write up anyway.
Sir George, would you go down to surgery 4?
Now we'll just pop a local in, open really wide.
Do you want me to wait outside while it works like last time?
No, don't bother. The next patient won't be numb yet. Tell me, you're something to do with the government, aren't you?
Yes, I am. Actually, I'm a government advisor on the NHS.
Really? So I'd have thought you'd want to go somewhere where you could have your treatment done under the NHS.
Ha! Good Lord, no. That's actually quite funny. Just because you advise the government on it doesn't mean to say you have to use it. I mean, everyone knows it's a cut-price second-rate service, but for some reason the public seems to think it's wonderful.
But you must be disturbed at the NHS deficit. I mean, since the pandemic, some hospital trusts are supposed to be well over £800 million in the red.
Well, we're not complacent, and we've instructed all hospital trusts to start getting rid of their debts immediately.
All I've heard is there are going to be new arrangements for people with chronic conditions like heart disease.
Yes, in the old system, whenever people had heart disease, when things got really bad, they went to hospital. Now they won't. And this is much better for the patient, because you don't want to feel really bad and be in hospital at the same time. It's just too depressing.
And you're hoping this will save enough money to pay off the debts?
It's not about the money.
What is it about then?
Well, it's a bit about the money. But the trusts have a policy that they won't do anything to affect the quality of care to patients.
But the trusts are cancelling operations, closing down wards, even entire hospitals.
Yes, but that doesn't affect the quality of services to patients, doesn't it? No, far from it. In some cases it improves it.
Really?
Oh, yes. Let me give you an example. The superbug.
MRSA? The one that's rife in hospitals?
Yes. MRSA. Now, we've highlighted the dangers of MRSA, but people have chosen to ignore it. I mean, I don't know what's wrong with them. They know how dangerous hospitals are, and yet they insist on going there. But you know, if you close down a hospital, you dramatically reduce the chances of you catching MRSA.
But you can't afford to close down every hospital in the country.
No, of course not. No, what we're trying to do is revolutionise the NHS by putting it on a market footing, and we're giving people choice.
What does that mean then?
It means you don't have to go to one hospital. You can choose where you want to go. Now, supposing I needed a hip replacement. I could get it done here, but I'd have to wait 3 years. Or I could get it done in Turkey. Although their track record on surgery means I could end up with one foot pointing backwards, so I'd end up walking in circles. Alternatively, I could have it done privately on Monday.
But that's obviously going to be much more expensive.
No, not necessarily. And the reason for this is the private sector is far more efficient than the NHS and much cheaper.
Really?
Yes, of course. The government won't be paying.
I've heard the government is planning on scrapping health measures like banning buy one get one free offers now. Surely the point of introducing that was to cut down on obesity, diabetes, heart disease, things which cost the NHS so much.
No, not at all. In the long run, it will save the NHS money. Advice on smoking too. Whenever they talk about how much smoking costs the NHS, they seem to forget that even if people quit smoking, they're still going to cost the NHS money when they get ill and die of something eventually. They keep telling us there's a huge pensions black hole. Perhaps we should be encouraging people to smoke so they can kill themselves before drawing their pensions and being a burden on us all. Rather than vilifying them, we should thank smokers for selflessly laying down their lives and dropping down dead and not costing the country a fortune by fading away with dementia in a care home. Don't you think, after the response to the pandemic has caused such a backlog of people on waiting lists for treatment, bringing down those waiting lists should be a priority? No, quite the contrary. The government doesn't really want to bring down waiting lists.
Why not?
Well, having patients on waiting lists for treatment doesn't actually cost the government any money, whereas treating them is very expensive. Also, there's the added advantage that many of them will get so fed up waiting they'll raise the money from somewhere and have their treatment done privately. In a way, we're quite pleased the waiting lists for operations are as high as they are. People can't see their GP, you wait forever for an ambulance, there's been a near collapse in NHS dentistry.
Really? Why?
Well, because if people see the NHS in its present form is not able to provide the service they want and at the same time is wasting millions of pounds of public money, then they'll accept that the only answer is privatisation.
Millie, does Mrs. Miggins look as though she's numb yet?
Hang on. Yep, looks numbed up to me.
Can you send her back down then?
Righto.
God, what an awful morning. Didn't even have time for a pee.
Well, you did ask me to put those extras in.
Yeah, I know. Still, I just had Mrs. Phelps down as a crown re-cement.
How was I to know she'd fractured the bloody thing off at the gingival margin? And guess what?
She's got to have it put back now. She's going to a wedding this weekend.
How'd you get on with Sir George then?
He was quite interesting, really. Turns out he's a government advisor on the NHS, which he seems to think is a complete basket case.
Well, we all know it's absolutely hopeless, with waiting lists going through the roof. Starmer says we've got to pay even more into the NHS.
Oh, come on. The NHS isn't underfunded. It's awash with money already. Give it more and it'll be spent on even more diversity and procurement managers, all paid about £150,000 for doing bugger all.
Hang on a minute. Procurement managers order supplies, don't they? That's what I do, order the stock as well as everything else. I think I'll apply to be a procurement manager if they paid that much.
Not only has the NHS got to cope with the backlog of patients who couldn't be seen due to COVID, we've got a cost of living crisis with energy bills doubling every 6 months and people saying they can't afford to buy food. I don't know what was worse, the pandemic or our response to it. We trashed the economy with the whole country under lockdown for almost 2 years, people sitting at home on furlough being paid 80% of their wages for doing nothing, businesses going bust because they weren't allowed to work. Did people really believe they wouldn't have to pay for it all sometime? One thing that amazes me is while the country's gone back to normal, GP practices seem to think there's still a pandemic going on. Perspex screens everywhere, all still wearing fucking masks.
I know. You can't phone for an appointment, you have to fill in a bloody form on their website, and then if you're lucky they might even ring you back. Actually seeing a GP is next to impossible.
Thought I might do a Zoom call with mine. I'm sure it's nothing serious, Doc, so I've called to ask you not to bother to have a look at it.